Welcome to Risk and Reward Corner, the ultimate podcast for traders, investors, and financial enthusiasts, brought to you by Stainless. Today we have with us Dr. Varsha Sathe, a dentist, founder of Arogyamitra Foundation and Health Clicks. Hi ma'am, how are you doing?
All good. So happy to be here.
We are also glad having you here today. So we have jotted down some questions which will relate to your field. So I would like to get them on. Doctors spend almost a decade studying before they earn a rupee. How does that late start affect the financial planning in your view?
The doctors do have a very long start, and I would quote one of my mama who told me when I decided to become a doctor that doctors do have a very long takeoff, like very long strip on which you have to go roll. But once you take off, you take off. So yes, we have a very long start, or we study for almost 10 years.
Yeah.
But more we learn, more we earn.
So how does that affect your planning in all?
I will say that from more of a perspective of this age now, I'm a parent and maybe my son will become a doctor tomorrow. So if at all your children want to become a healthcare professional, you should have a financial plan in place. And for the students who want to take up healthcare, I'll say that you start earning around the same time your peers in engineering or any other field will start earning, because we do have a stipend after we complete our degrees. It is not much, but it is there.
Yeah.
So you can start investing a small amount of it out of that, and that will give you that start when you start your clinic or you want to do something, maybe a post-graduation. That can will act as a foundation maybe.
Yeah, that makes kind of sense. Have you explored the stock market or mutual funds or SIP, or did you go to the traditional FD and real estate one?
If I have to be very, very frank, like I got married very early.
Oh, okay.
And for the initial part of my life, though I was working part-time.
Okay.
And I was primarily taking care of the home and children.
Yeah.
So in the initial part of my career, it was all whatever I used to earn, I used to spend, or I used to enjoy.
Yeah.
Then the shift came when the COVID came.
Okay.
And at that time we are into the non-emergency branch. Like I'm a dentist, so it is a non-emergency branch. Our OPDs were closed, and when we restarted again, we were at the highest risk because we work in the mouth and you have to remove your mask when we are working. And that was a time of uncertainty and our professional incomes were not certain.
Yeah.
So that time that attracted me to the side hustle, how you people say.
Yeah.
And at the similar time, I also started with my digital marketing company. I'm also into the digital marketing for doctors.
Okay.
So I came in contact with a lot of young minds and young and intelligent minds like you, and that made me think about a side hustle.
That sounds really interesting. So what was the side hustle?
That was the digital marketing company I started. And I also took up your kind of investing. Till that time, for the most of my earning time, I'll say first 10 years, I was just enjoying, because my clinic is a part of a chain of clinics where my husband is also a dentist. So kind of I can say the savings were taken care by him. So I was blessed like that. Yeah. And when this happened and I started thinking about the side hustle, and that was only my money, then I started thinking about the ways to invest it. And that time I started my journey into the investing, into the market, as well as not that much of market, I'm more into mutual funds at that point of time.
Mutual funds. Yeah, I was just about to say that I couldn't get it very much clearly, like which exactly mutual funds or SIP, that was my issue. So, did you go for FDs anytime? Like,
yeah, for the specific
anybody around you who are into FD? And
frankly, as a family, we are very traditional. When I say investing, they are very traditional. We are into PPF, we are into FDs. They do this properties for investing. But we realized that in maybe 10 or 15 years that we were doing all these things, but our money didn't grow the way the money of our peers grew, who were doing similar financially like us. And that is what attracted me to the market or mutual funds. I did start only with the mutual funds, and now I'm more and more moving towards the market.
Yeah. That's because it doesn't grow at the same rate as inflation.
Yeah, exactly.
That's how it affects. So that was apt. Do you manage your own portfolio or work with an advisor? What's your thinking there?
Again, my portfolio is combined with my husband. My husband has a manager
So
fund.
that was post-COVID.
He has been he was into mutual funds before also, but as I told you, I was ignorant about the finances for the greater part of the initial part of my career.
Yeah.
But when I started taking interest into the finances and investing as such and managing my own money, I have always managed it on my own. Of course, I had very good mentors from the families who suggested me how to be safe in that space.
That's great. As a self-employed professional, there's no EPF or no pension. It's all on you. So how are you planning of retirement?
Initially, we did invest into PPF, so
Okay.
that was our mainstay of our this. And that is something which government has given for the working professional who don't have the, I'll say, the pension.
Yeah.
But now again, I have a part of my portfolio which I have invested for my.
So there's a plan B.
There is a plan B, because again, as you said, the inflation and our investment, the return on our investments is not matching.
Yeah, also, like you said, the COVID was a turning point for most of them in their lives.
That's true.
So post-COVID, everything totally changed.
But
Everybody, the way they look at.
But I would like to say that we have actually come out of COVID in a much better way. Because even as I don't know, I don't understand economy and all those things that much, but I see that more and more people are investing into the stock market, who didn't have any knowledge of
Didn't
it,
at all knew about it earlier.
and we are doing good.
So there is a lot of awareness post-COVID because everything got online, and before that it was kind of rare. Before that, the internet and everything. Post-COVID, everything is online currently. So the work started, hibernating due to COVID, and then it had to be online.
And sometimes what happens is, unless we are pushed against the wall, we won't come out of our comfort zone. Maybe that happened for most of us at that point, and we started thinking differently, and that is why that has given us an edge now.
That's really right. If a freshly graduated doctor come to you and ask and say, "I got my first paycheck. What do I do with it?" What would you tell them?
I'll tell them, go for 50, 30, 20. Okay. As we were talking,
that the traditional finance rule.
I don't know. That is a traditional finance rule. I'll just explain what is my rule, and if it matches with the finance rule, I'll be a very happy person. So, as we were talking, the doctor has a very long time studying, and they don't get the money that early as other professionals. So, 20% you should enjoy. Don't worry, don't think about anything. You have hard earned that money, and you should enjoy the 20% of your money.
Self-care.
Completely go for self-love. Whatever you want to do, you can do. 30% it should go for the your future, like immediate future, wherein if you are planning to do a post-graduation or you are planning to set up a practice. So a lot of things are needed when we are starting something new. So you can invest that money short term for 30% for your near future, which will give you more money. And 50% should go into the what is most important for doctors is two things. One is skill, your own skill, and second is team. So you can always, as a freshly passed out doctor, you should have a team of doctors, maybe your friends also, because we are very thick friends during when we are studying, because our course is that demanding and you have to depend on each other. So you can have a group practice where all of you invest together and come up with the facilities, because now this is, I think, the policy thing what we as doctors feel, which is happening is government is making the rules so that the small facilities, for the small facilities to run their small clinics or hospitals is becoming difficult and difficult.
Individually, it's difficult.
It is more
Along
difficult.
with group, it's easier.
So we are going towards Western healthcare more, where there is a government facilities and there is a there are corporate hospitals.
Yeah.
But in India, the mainstay of healthcare which we provide is the smaller facilities, and they are providing a good healthcare at a considerably affordable rates,
Yeah.
which runs almost the middle class of our country.
Yeah.
So if at all we want to cater to them, then you need to come together and form the group practices. That is what is going to, I feel that is what is going to help in the future. So invest that 50% into building that skill and the team is what I'll say. So 50% into for your facility, 30% for your skill, and 20% for your enjoyment.
That makes 100% of it. How about just like, I thought the 20, 30, 50 would also have the general utility things. So I guess
like your like your day-to-day expenses. Mostly when you graduate, your parents are taking care of it.
Okay, yeah, that also makes sense. Yeah.
So tell your parents,
especially when you are studying
medicine.
Yeah.
Because that's what I told you as a parent. If at all your son or your daughter is thinking about medicine, you have to support
parents
them.
Have to plan everything
For at least 15 years, I'll say. Okay. If at all you are able to give that support for 15 years, then your child will have a foundation and he won't need you any time in your life. But at the same time, I'll tell this to children also, because that was the case when we were graduate. We tend to compare ourselves with our friends, fellow friends who are maybe from the engineering or any. At our times, they used to get this packages of 1 lakh per month. Okay. Was like considered very good. And we all used to think, and that time I was getting a stipend which was 1200 rupees a month. So it becomes a problem, kind of a self-respect problem for doctors initially when they are studying. Yeah. But of course,
there will be a lot of comparison and peer pressure, etc.
Hold on. Aapka time aayega. That is what I want to tell all the children who are taking up medicine. You have to put in a little more years.
Lot of patience.
But after you have done that, the takeoff is going to be something.
Yeah, that makes total sense. So I would also like to know, you are a mother, a housewife, and practicing doctor, as you said. So how it is all for you, like on the entrepreneur's end, for women especially?
I would say that we have the skills. Even in my generation, we had the skills to earn money, but we were conditioned that somebody else is going to take care of our money. Yeah. So we did have the earning freedom, but we never had the spending freedom. Okay. So that is one thing when it comes to freedom, complete freedom when it comes to money. Women should think about managing their own money. Yeah. Because that is one thing which I realized when I started with my foundation, is if at all you want to do something which only you believe in, then you need to have the money for it by yourself. Nobody, even if your husband or your father loves you, or for that matter your mother also, loves you, but they are not going to give you money for something which they don't feel is right. So, if you want to be independent women, then you have to take care of your own money. And you have to earn totally and manage both.
Well said. So, all the women should see this podcast. They have to make it a point to look at their own finances, so that they will have freedom to spend it on their own.
Yeah. And I would like to add another thing. We feel that as women, we don't have money. If at all, especially if at all we are homemaker, which a lot of women of our generation were. But I feel homemakers do have a lot of money in their hand. And if you are wise enough, then and you have got ki where to invest. Like, don't invest into things which are only for the show and they are going to depreciate with time, rather than invest into a skill maybe which will give you money in future. Today maybe your children are small and you are not able to work, but there will come a time when they will grow up and they will go away, and you will have, I always say, for a woman the career starts at around 35-40. I have seen my productivity has gone up like anything after my children have grown and they have started doing on their own. And also by that time you have that maturity.
And you also have time for yourself at that time.
So if you have developed the skills when you were, I'll say by choice also, I made that choice. I took a break for 5 years for my first son. But at that time, if I have developed a skill which has helped, which can be of use to earn money at this point, so you are through. You are sorted.
Yeah, that's right. What made you choose dentistry? Passion, accident, or family influence?
Healthcare was a passion.
Okay.
Healing, healthcare was a passion. Dentistry was an accident.
Okay. So, when you say healthcare was a passion, what was the trigger?
I have this inherent, that is a joke in my family. The most happiness Varsha will get, what is the thing which will give Varsha the most happiness is Loka Kalyan. Like, if at all I am able to do good for somebody, I am the happiest. So, it was like pretty much, healthcare is one profession which will give you a satisfaction. You are able to make people feel better. So that was the, I'll say, the passion side of it, and the practical side of it, I am very bad at maths.
Oh, okay. So you find your happiness in others' happiness is what you meant.
If at all I am able to help somebody, I feel happy.
That's really wonderful. Was there a moment in your career where you almost gave up but didn't?
Yes, COVID. COVID was that, this, because it was very uncertain. And we were very high risk branch, and as I told you, healthcare came like it was a passion, but the dentistry was the accident. And though I am working on dentistry for 22 years, I am more on the preventive side, and I manage things, and I take care of the marketing for our clinic. Operational dentistry is more taken care by the team and my husband, who is also a dentist. So there came a point in our life wherein there was high risk during the second wave. I also lost very close people, loved ones in the second wave. At that point, it was like both of us should we take that risk of going to the clinic.
Yeah.
And I was feeling to be very frank, I was feeling very low, very insufficient. Okay, I cannot take care of the whole thing. Like, I cannot operate all the things so that it will earn my family the living. But at the same time, my degree didn't have value at that point.
Okay.
Because BDS degree, you don't get a job, that good job, how much you can earn in the private practice. But in that time of uncertainty, we decided that Rahul, my husband, is going to take that risk and he is going to keep working, and I am going to look for any other options.
Yeah.
So that time we started, I did my digital marketing course, and I started because healthcare is something, and rather health education is something which I am very passionate about, and now I have understood that is what my primary calling is. So then the things started changing.
Yeah, definitely COVID was a very coarse time for everybody in their life, and I think that was the time we explore ourselves, and we have reached this point. So it's a wonderful thing you have shared with us. How do you balance your professional life and philanthropy? Like you said, you love social service, etc. So do you shed some light?
Yes. So Arogyamitra Foundation, basically we started it. We are 4th generation of doctors in our family. And all 4 generations were of different specialities. But one thing common between all of them was we have always enjoyed the trust of our patients, which is becoming more rare nowadays. The tendency for general public to doubt their doctors is increasing because of various reasons. COVID was again the turning point in it. A lot of things happened during COVID where now people do doubt the healthcare profession. So, and when I was thinking about it, I thought that it is because there is a miscommunication between the doctors. Doctors are very busy treating the patients, but sometimes they are not communicating that well with the general public. So that leads to doubt. So that was the starting point of Arogyamitra, where we started the awareness-based foundation, wherein there is I'll say a need for bridging that gap, and that makes life better for general public also and doctors also. So I don't have to balance. It is a kind of an extension of my professional life as a doctor, wherein my role as a doctor was more counseling the patients or working on the preventive, how you can stop the dental problems. So it was kind of an extension of the work I was doing, only it got a structure through Arogyamitra Foundation.
That's great. Yeah, like you already know, we are into risk and reward corner. So, what was the one risk which rewarded you greatly?
Stepping out of my comfort zone as a doctor, because we doctors are conditioned that money is not for us. Money is always a byproduct. And that is how I'll say the medicine should be. You should become a doctor if you have a primary love for healing people. Money is always a byproduct. You will get money. All the doctors do well in life.
Yeah.
But primarily we don't focus on money. When I shifted from that space, like healthcare space, to maybe the digital space, that was one block which I had to overcome. And to be very frank, my family didn't support. As I told you, we are 4 generation of doctors, never marketed. So when I said that I want to start this, they were not very supportive. They were not against me, but they were like, think what you are doing. Because Sathes is a legacy. And I am a daughter-in-law. So you cannot, and our foundation is called as Dr. Sathes Arogyamitra Foundation.
Yeah.
So that is there, always there at the back of your mind. Okay, they have built something for 4 generations and you should not do something which can disturb that. But at the same time, when I step into it, and now it has been 5 years, and whatever responses I get from the profiles we take care of, or even for the Arogyamitra, whatever work we have done, now we have a lot of people who sponsor the things for Arogyamitra. Like we had a cancer series which was sponsored by Polyhedron Foundation. So all that trust is something which gives me that confidence that the risk I took to step out of that comfort zone has paid off.
Okay, that's great. So, like you said, you used to not save before, and how did you start the digital marketing agency? Like, I mean,
digital marketing agency
in the financial perspective.
On the financial perspective, as I told you, like we were talking about it, we had the skill. I was conditioned. I got married at 22. So I always say that, again, it can be taken as a joke, but it is a very hard-hitting joke. Okay, I'm a strong woman, but I'm a dependent woman. And I have been dependent.
Both at a time.
Yeah, on my father and my husband for my finances. So when I had this dream of starting something, I needed that freedom when it comes to finances. So something like HealthClicks is the name of the company, digital marketing company, where we take care of the profiles of the doctors. We are only into healthcare. I don't do marketing for any other people, only healthcare, because healthcare is something which I understand.
Expertise.
So that was something which was the money which I earned, which nobody will question.
Yeah.
And that is the seed money which I put it into the Arogyamitra Foundation.
Okay. So you said while starting digital, you didn't get support. I wanted to know that how did you manage to get finances for digital marketing?
I was earning. I was earning. My clinic is 13
So when you had that idea, you were like putting up your.
And the financial dependency was more from my side.
Okay.
They never said that you be dependent on us and we will take care of your portfolio. Since I was not doing it, they were doing it for me. So when I said,
now it makes sense.
I'll take care of my finances, they never resisted that. Okay. But they, at the same time, they were like, but I understood at that point, ki if at all I give my portfolio to manage to somebody, ultimately, I won't have the final say in that. Because if a family member is taking care of your portfolio, it is his idea which he is implementing. May not be it is my idea. So when you say that about risk, even the risk appetite of every person is different. Maybe I am a more risk taking person than my husband, and I'll do better if I do invest in this gold bees, silver bees, and metals are on fire, and so I invest in them for the short term, for the self-love 20%, so that if at all I'm not getting it also, there is no problem there. So maybe that risk appetite my husband doesn't have. Okay. So that kind of thing.
That's totally right. It's always risk versus reward. Like the more risk you take, you'll be rewarded equally. That's a great idea, I think you had started with. If I met you 15 years ago, would I meet a dentist in making or a future change maker who just hasn't discovered her platform yet?
I won't comment about the change maker part, but definitely not dentist in making, that's for sure. Looking back, I would have maybe made a different choice, because as I told you, healthcare healing is my passion, but dentistry is something which was kind of an accident. So maybe, and frankly, working 22 years in dentistry, I have been working more on prevention. That is what my passion is.
Yeah.
So if at all you feel that prevention is change making, then definitely a change maker.
Well said. What keeps you motivated on difficult days?
The happiness or the satisfaction I get from my work.
आरोग्यमित्र फाउंडेशन का आइडिया कब और कैसे आया? Like, was there a specific moment or incident that pushed you?
Kind of. Again, COVID. In COVID, we started a digital platform called Health Paths. Again, because of the lot of misconception, lot of confusion was there between the doctors, like the healthcare and the society. So we started that platform. All the doctors from my family and friends came together, and one of our most viewed session was on All About Belgium, about COVID from different healthcare professionals. There was a homeopathic consultant, there was a psychologist, there was an ENT surgeon, and there was a pathologist telling about all these COVID tests and all that. Yeah. And that was viewed by general public, and a lot of people told us that a lot of confusion was cleared because of that. So that was the moment which I thought about, ki this is the area which needs a lot of work. Okay. And awareness part. And this happened in 2021. And as I told you that we completed 100 years in healthcare. The Sathe's completed 100 years in healthcare in 2023. And a lot of people told me like this is very rare. And we are practicing at the same place. Yeah. Like where my husband's great-grandfather practiced, at the same place my husband is practicing. Yeah. So that place has been that a kind of a hope for so many people, and people do come there because his grandfather was a general practitioner. So and he was a old, like family physician kind of general practitioner. People still remember him, Dr. Varsha Sathe, with his legacy of just healing people by talking to them also. Of course, he was an MBBS doctor, he did give the medicines, but I realized that this communication is the mainstay of healthcare, which is getting lost somewhere along the way of the corporate hospitals, and sometimes even our tendency to go to the specialist. Okay. So that was the thing which motivated me to start a foundation which was awareness based. So I can say that it was the motivating factor for starting Arogyamitra.
That's a great start, I guess. You have great observation, and you took a great stance on what you observed and built upon that. Running a foundation takes more than just passion. It takes real resources. How did you manage the working capital and day-to-day funding for Arogyamitra?
The seed money came from my own savings. But now 3 years into it, I always feel that whenever you are working from something, when we call the foundation, the general perception is that they are going to give something free.
Yeah.
So Arogyamitra Foundation was very different, where we wanted to work on the healthcare, which is preventive, accessible, and at the same time, we will try to tell you what you can do for your health. So the concept was abstract, but I will say that I have been blessed with people who understood the concept, and now the funds are coming. I didn't have to try very hard, and I stepped into it with this concept that even if nobody supports me, I'll do it on my own. Like, the society has given us so much for 4 generations. Since it is my family foundation, it was kind of a giving back to the society for me. People and the society and the community has given us so much of love, so much of trust over 4 generations. So why not give back to them, with something which I truly believe in. There is health. Today it is discussed so much. I'll say that it is an industry. But when it comes to health, if you get the basic right, you will lead a healthy, happy life. And that is what Arogyamitra stands for.
So always we say healthy, wealthy and wise. First comes health, then wealth. That's truly right, but I also want to know, like you said, there's money flowing in. So is it from the doctor community or any other industry as well?
Yeah.
You mentioned hydro something some time ago.
Yeah. Yes. So the money is flowing in from the people who have understood the concept. One of them is Polyhedron Foundation. One of my friend, Mr. Gautam Saman, is part of that Polyhedron Foundation.
So they're doing it part of CSR activity.
For Polyhedron, it is part of CSR activity. Also, we are supported very well by the KLS group. We have this institutional wellness program, which we take the awareness for the students as well as faculty, both in GIT Engineering College and also in KLS IMER. So where the doctors go and we talk about different topics related to the health. Also, as you said, a lot of doctors also are now getting attracted towards the concept, and we do this podcast with the doctors. And they also support us for our various events. We did Health and Fitness Expo in November. So a lot of doctors came forward and they gave the event, the sponsorships and all that. Because as doctors, we understand we are dealing with the patients day in and day out. And so many times that doctors feel that ये पेशेंट को ये पहले पता होता या पेशेंट 2 महीने पहले मेरे पास आता तो I have this strong belief that no doctor wants you to suffer.
That's right.
Against that unpopular belief that doctor पैसे के लिए काम करते हैं. If at all you have gone through that 5 years of rigorous training and what we have seen in those OPDs or in those operation theaters, that is something different. No doctor wants you. We value the human life and human health the most. So your doctor wants you to be well. So all the doctors out there who are very proactive about this, or they want to do this and they were not able to find the mean to do it, opportunity to do it, are coming to Arogyamitra now. And they want to do it through us, and we are always there to help. So that is my appeal to all the healthcare professionals also. If you have some concept which you want to create awareness about, we are always there.
What one last thing you would like to say our audience?
I would tell all the women out there, you have lot of money you can invest, and don't only invest for the future of your family or the future of the children. Also invest some part of it at least in the skill development, so that you won't only get the money which you will get, but you will also get the happiness doing that thing, and you will be really empowered, I feel.
It's really great time with you. Thank you for being here with just one invite. It truly means a lot for us.
It was a pleasure.